friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics so far we have discussed in a very systematic fashion. My dear friends, you know that we are discussing about fever in childhood period. In this series we have already explained about the basics of the fever and how to diagnose in first few classes. Almost 10 to 15 parts we have covered, and thereafter in next 5 parts we have covered different cases. So how to diagnose a viral fever, how to diagnose a bacterial fever, how to diagnose through the case presentation we have studied that. And today onwards we will see 1 or 2 classes related to clinical evaluation of the fever, which is very important, and thereafter we will see some of the important parts related to Ayurveda understanding. Now go for the clinical evaluation of the fever as it evolves. So fever is coming, and we know that fever is our friend, it is not our enemy, and continuously we are also telling that we should not overtreat the fever. But one thing is which is very important during all this process is assessment of the severity of the fever. The rules that I have told in the previous classes holds good if the patient is not serious. Okay, if the patient is serious, we have got different types of approach. Now how you come to know that the child is having fever and it is not serious? How to assess the seriousness of the fever? Very simple. To assess the seriousness of the fever, you have to ask 2 questions and you have to look at 2 things. That's all. Totally 4 parameters are there. What are the 2 things that you have to ask? Number 1 is, first thing that you have to ask is, what is the behavior when the fever comes? Whether there is any change in the behavior of the child when the child is having fever. When I say change in the behavior means it is nothing but a sick looking child. That means during the time of the fever, child is having irritability. During the time of the fever, child is having convulsions. During the time of the fever, child is having restlessness. During the time of the fever, child is having giddiness. So that means behavioral changes. Okay, so this you have to ask. Suppose if the mother is telling that any of these behavioral changes are there, then you have to take that fever continuously. You have to monitor that fever continuously and take it seriously. And you should open yourself for all options. Number 1. This is the first question that you have to ask. No, when the fever is coming, child is going to the bed and is sleeping, and once the fever comes down, he get up and start playing. So this is a safe fever. It's a safe condition. There is no any issues. Okay. Now second question that you have to ask is, what about the urine outputs? Now this is very important. During the time of the fever, what is the urine output of the child? If the urine output is okay, child is passing sufficient amount of the urine, that suggests that the perfusion is okay. Because see, during the time of the fever, actually what happens is child refuses to take the food and also child refuses to take the fluid. Okay, because there will be loss of appetite will be there. So this leads to the fluid imbalance in the body and also nutritional imbalance in the body. That's the main issues, especially electrolytes, etc. And ultimately what happens is the vital organs will get affected. Now once the patient is passing or child is passing good amount of the urine, that suggests that perfusion of the blood is okay. Okay, that means the nutrition and fluid balance of the child is okay. So that is a safe condition. If that is not the case, encourage the child to take good amount of the fluid and also good amount of the easily digestible nutritional foods. So these are the 2 questions that you have to ask to assess the severity. That's all. Number 1 is, what is the behavior of the child, and number 2 is, what about the urine output of the child? If the both are okay, then it suggests that child is out of danger, although he is having severe fever. Number 1. 2 things that you have to see. These are the 2 questions that you have to ask. Now 2 things you have to see. What is that? Number 1, heart rate and as well as respiratory rate. Okay, yes, heart rate should be regular, respiratory rate should be also regular, and respiratory rate and heart rate should be in proportion to each other. Now heart rate may be faster, there may be tachypnea. Okay, there may be tachypnea. there may be tachycardia and there may be tachypnea. Heart rate and respiratory rate may be faster. It is not an issue, but it should be regular. It should be regular, and they should be proportional to each other. For example, relative bradycardia, which is in typhoid fever. Okay, the proportion is 1:3 or 1:3 or 1:4 proportion of the respiratory rate and as well as the heart rate. That has to be maintained, which is not maintained in case of relative bradycardia, which is commonly seen in case of typhoid fever. So whether there is irregularities of the heart rate or a rhythm problem is there or ectopic beats are there or whether they are proportionate or not proportionate, these are the things that you have to see. If these two things are okay, heart rate and respiratory rate is regular, although it is tachypnea and tachycardia, no issues, but should be regular. Okay, definitely when the fever rises, the respiratory rate also rises and the heart rate also rises. 1 degree of temperature usually give rise to a increase of 10 heartbeats. So this is quite normal as far as fever is concerned. But it should be regular, it should not be irregular. So these are the two things that you have to ask, and these are the two things that you have to see to look at the to assess the severity of the fever. If these 4 items are okay, then there is no need to worry about the fever, no need to worry about the seriousness of the fever. Okay, I mean to say, you just continue to give the good amount of the fluid, good amount of nutritional food as far as possible orally, and frequently check the heart rate and respiratory rate. If they are fine, then everything is fine. Thank you very much. So this is how to assess simply in the OPD basis, how to assess the severity of the fever. Thank you very much. In the next class, we will again meet with another important topic related to fever. Thank you.